Hello, my name is Henwasin Sweety Lorin, and I'm a speech language pathologist and audiologist. So today I'll be speaking on the importance of early identification and early intervention of speech and hearing problems in children. So let's go directly to the definitions of speech. Speech is nothing but the oral production of sounds that is produced using our vocal tracts and the articulators, the lips, the jaws, the tongue. And language definition is the production of sound plus the body gestures that we give during communication. And hearing is nothing but receiving signals through your auditory parts. So, speech disorder, let's just move directly to the speech disorder. We see that speech development happens as soon as the child is born. So, the speech development is the birth cry. And whenever there is a speech disorder, you see that there is the rate of speech is abnormal. There is the speech is not clear. It's not intelligible. We see that there is substitution, omission, distortion, and addition of certain sounds in the words. And we also see that altogether we see that the meaning is not clear of such speech. So as we categorize it, we can see that there is this stuttering, the cluttering, stammering, and there is this misarticulation, and also there is this voice disorder. So when we talk about the voice disorder, it would be puberphonia, it could be androphonia, and voice disorders such as breathy voice, harsh voice, all these things. So looking at the speech disorder, it can be anatomical, it can be physiological, or it can even be emotional that may be triggering this problem. And a child who has a speech disorder would definitely have a communication problem, would have a low self-esteem, and would slowly, if not rectified at the proper time, if not intervened at the proper time, they would even lead to learning disability, which may affect their educational performances in school, or it may even hinder their performance in their further life. And in language disorders, we see that there is this linguistic and the pre-linguistic components. And we see that before the linguistic components happens, the pre-linguistic happens first. So under pre-linguistic, we have this eye contact, the social smiles, eye-to-hand coordinations, sitting behavior, listening skills, attention, concentration, all these things. So a child with a poor pre-linguistic skills will not be able to develop a proper linguistic skills in his later life. So pre-linguistic skills is the proper passage to lead to a proper linguistic development. So under linguistics, we have this expression and comprehension. In comprehension, we see that it is nothing but understanding of speech or understanding of certain comments, or understanding certain emotions, certain feelings that he can see through his parents or from the environment or the people around him. So in comprehension, if a child is not able to comprehend properly according to his age adequately, then there would be disruption in the development of certain areas. There would be developmental problems in the understanding and memory, and also this may further lead to inadequate school performance as well, so which will lead to learning disability. And in expression level, we see that when we understand the term language, it is nothing but a meaningful speech that is uttered or given out in a very using gestures or body movements. So when a child is not having a proper expression development, we see that the child will not be able to express what he or she wants or he or she likes properly or adequately to their parents. So when a child is not able to express what he or she wants, then the child becomes frustrated and they tend to develop behavioral problems. So the child may tend to develop ADHD, and they may tend to develop some other other problems which may hinder their social life, their communication, and also their educational development, leading to learning disability. So, if we have to categorize the language disorder, we have the specific learning impairment, and we have this learning disability, language learning disability, which is caused by the central nervous system dysfunction. And also, we can add the autism and brain injury, mental retardation, and deafness. All these things are the categories under the language disorders.